Hi, welcome to our poster about the Secret Garden, Staff Caring for Staff. My name is Jennifer Schlebusch, and I work for the Behavior Response Team. And this is my colleague,
Erin Quinlan. We're here today to talk to you about our poster and explain it. Jen and I, working in behavioral health for many years, we have always relied on relaxation techniques to decompress due to working in a crisis environment. But all healthcare workers experience stress. And Jen and I thought all staff at BCH would benefit from learning and engaging in relaxation techniques as well. We had several reasons for thinking this. First, we must acknowledge that healthcare staff work in one of the most stressful environments. Not only is the patient care acute responsibility is high, not only are they tending to these needs, they are also managing outside life challenges. Employees are balancing being in school or questioning going back. They may be faced with an illness, whether that's specific to that person or their family, or whether it's more towards a pandemic that has occurred. On top of that, government and political issues arise, and this can always bring fear, increased stress, and uncertainty to many. Lastly, all healthcare workers are part of a family, and whether that entails being a caregiver to a parent or balancing pickup and drop off, all add additional stress. This is why we believe and are passionate about highlighting the importance of the need to prioritize work-life balance, specifically staff well-being. So Jen and I, in 2020, was accepted into the EBP program, and we began our research. We focused on perceived staff stress when receiving complementary and integrative health modalities, specifically Reiki, versus those that do not. 155 articles were reviewed. After exclusion, 11 were included, as well as obtaining 2 expert opinions. The research was strong and was found to show that not only Reiki, but a variety of modalities had the ability to promote relaxation and decrease staff stress. Finding that stuck out was that there had been more participation when a dedicated space was appointed for staff engagement in the modalities. So in 2021 and 2022, we continued our research and developed a proposal for a recommendation of a change in practice. To note, during this year, staff were encountering higher than normal stress due to 3 main factors. There was an impact from COVID-19. There was also a pediatric behavioral health crisis occurring, and the acuity and volume of patients was the highest ever, occurring in both medical and psychiatric admissions. In 2022, our proposal was accepted into the Nurse Science Fellowship, and we started to begin developing the operations of the Secret Garden, and once launched, began recording data to prove utilization of the space. We opened the Secret Garden, which is a private, dedicated space for staff only, that staff can engage in self-led relaxation activities, and/or they can participate in practitioner-led offerings when held by certified and trained clinicians. Over the past year, we've collected data by 2 ways. One, a survey that is left in the space for staff to complete post any time using the space or after practitioner-led offerings. It evaluates their stress prior and post use of the space via Likert scale. It also has a section where they can provide feedback to obtain qualitative data. We also record the number of badges that are monthly recordings obtained from security. Each staff member must badge in to enter the space. This can identify any existing trends and provide times of use, assessing for frequency and when most utilized. Our data so far has been great. Our key points, we've had a steady increase in utilization. Since opening in November, we've had a 337% increase in utilization, and the trend continues to be upward. We had 2 outliers that were higher, 2 months that were higher than usual, and we have correlated that towards 2 things. One, offering practitioner-led offerings in that space during one of the months. And the second month is during Nurses Week, when the Wishing Stone Garden was opened, which is located directly next to the Staff Wellness Center, the Secret Garden. This allowed for more awareness and for people to be able to know that it exists. Some common themes that we also obtained from the feedback from the staff is thanking us and being grateful for the space, desire to seek more practitioner-led offerings, expressing the positive impact on their mental health to return to their shift. In addition to employees that were pregnant, expressing gratitude to have a quiet space, as well as utilizing maternity bouncing balls. From the surveys, all surveys that have been collected have shown a reduction in staff stress post-visit. The majority ranking stress pre-visit has been ranked at 3 or higher up to 5. Post-visit, we have seen that the majority of the rankings are 2 or less, 2 to 0 on the Likert scale. We can show that fostering positive mental health strategies and habits and allowing staff to reset and recharge has shown to reduce staff stress per staff report via their feedback. We did have some barriers that we had to overcome. First, gaining acceptance. These are non-traditional methods within a biomedicine system. They are new and unfamiliar practices that we must introduce to staff. There is also a lack of high-quality evidence-based research on this topic. This is also currently a pilot, and the reality of the potential loss of the space is existing. We also had to worry about funding challenges, which we came up with solutions for connecting with the volunteer program and also working with CultureWorks to obtain a dedicated space. We also have worked with clinicians that have dedicated hours for wellness initiatives to provide services and offerings in the space to staff when possible. For our next steps, we'll be creating videos for our webpage, recording practitioner-led practices to publish on the internal webpage for those that are at home or in satellites to utilize. We plan to maximize resources and increase hours of available practitioner-led programming. We would like to explore in-person opportunities for satellites. We will continue to collaborate with our nurse scientists regarding grants and writing, publishing a manuscript. And we are already starting to plan for future program operations and funding for supply replenish and practitioner-led programming. We would like to thank and acknowledge Mary Pointer-Reed, our nurse scientist for the Nurse Science Fellowship Program, as well as the Nurse Science Fellowship Program for their support. Also Dick Argus, Ryan Thompson, Leslie Harris, and the CultureWorks department. We'd also like to thank Pat Pratt, Doug Crook, and the Inpatient Medical Surgical Programs. Also the Evidence-Based Practice Program, our volunteers throughout the BCH employees that provide services, and all BCH staff for the enthusiastic support of our work. Thank you.